When you're a parent and you have that nagging feeling that something might be off with your child's development, it's a really stressful place to be. So in this explainer, we're going to break down two specific spinal cord conditions, spina bifida and tethered cord syndrome, to help you get the clarity you're looking for.
It's probably one of the toughest questions you can ask yourself as a parent. That feeling, that little voice in your head, it's real and it's completely valid. Our goal here is to just walk through the essentials together so we can replace some of that uncertainty with clear, solid information.
So first things first, it's really important to understand that these kinds of concerns can pop up at any point. A diagnosis isn't always something that's obvious from day one. That's why being aware as your child grows is so important.
You know, for some families, they find out about something like spina bifida during a prenatal ultrasound, before the baby is even born. But for others, the first hints of a tethered cord might not show up until a child starts walking or running, or even during potty training. It's this wide range of possibilities that makes being observant over time so critical.
Okay, so let's get to the heart of it. We're talking about two conditions that both affect the spinal cord, but they're actually fundamentally different. Let's really break down what makes them unique.
All right, first up is spina bifida. The easiest way to think about this is as a structural issue that happens right from birth. The spine is like this bony armor that protects the spinal cord, right? Well, with spina bifida, that armor just doesn't close all the way, leaving a part of that delicate cord exposed. How serious it is really just depends on the size and location of that gap.
Now, tethered cord syndrome, that's a totally different kind of problem. It's all about movement. See, normally the spinal cord kind of floats freely inside the spinal canal. But with a tethered cord, it gets stuck or attached where it shouldn't be. So as a child gets bigger and taller, the cord gets stretched out, and that puts a lot of dangerous tension on all those important nerves.
So, let's just lay it out side by side to make it super clear. Spina bifida is about an incomplete structure. That protective casing of the spine didn't finish closing. Tethered cord, on the other hand, is a functional problem. The structure might look fine, but because the cord is stuck, it can't move freely, and that's what causes the stretching and the damage. One's a closing problem, the other is a freedom of movement problem.
This brings us to probably the most important question for you, right? What should you actually be looking for? Knowing the signs is really the first and most powerful step you can take.
The tricky part is that both conditions can show up in pretty similar ways because they're both messing with the nerves that control the lower body. So you might notice issues with movement, like weakness in the legs, a change in your child's walk, or even a curve developing in their spine. And it also really affects things you can't see, like bladder and bowel control, which can be a huge red flag.
And beyond those symptoms, there can also be some visible clues. Right there on the skin of their lower back, you're looking for things like a really deep dimple, a little patch of hair where you wouldn't expect one, or maybe an unusual birthmark. These can be really important markers for an issue deeper down, and if you spot one, that's a very clear signal to get it checked out.
Okay, so you've noticed a sign and you've made that call. I know, the phrase neurological evaluation can sound pretty intimidating. But really, it's just a clear, step-by-step process designed to get you answers.
So what does it actually look like? Well, it usually starts with just a conversation, a detailed talk about your child's history. Then comes a hands-on exam, where they'll test things like strength and reflexes. To really see what's going on, they'll almost always use an MRI. And from there, it's all about coordinating with other specialists and figuring out a plan, which, sometimes might include surgery if symptoms are getting worse.
And please remember this, getting a diagnosis is not the end of the road. In fact, it's the beginning. It's the start of a supportive, long-term partnership with a whole team of experts. And this is just a crucial idea to hold on to. The care your child needs isn't a one-and-done thing. It's constantly evolving. What an infant needs is completely different from what a toddler or a teenager needs. The whole point of long-term support is to adapt every step of the way to make sure they have what they need to thrive.
You are not doing this alone. A whole team is built around your child. You'll have the neurologist, who's kind of like the team captain. You might have a neurosurgeon, a urologist for bladder health, an orthopedist for bones and muscles, and physical therapist to help with strength. It's a true team approach, with your child at the center. And I want to leave you with this powerful message of hope. With that amazing care team, with consistent therapy, and with the right accommodations, the outlook for so many of these kids is incredibly bright. The goal isn't just to manage a condition, it's to support them in living a full, active life. Because ultimately, that's what it's all about, isn't it? It's not just about treating a problem. It's about providing that consistent,
early, and evolving care that lets a child reach their absolute full potential. We really hope this has helped bring a little bit of clarity to your journey.